Risk factor of tuberculosis. Anyone can get tuberculosis, but certain factors can increase your risk of the disease. These factors include weakened immune system. For example, HIV or AIDS, a patient with end-stage kidney disease, and diabetic patient. Other examples are malnutrition disease, patients who receive cancer treatment, so they are immunosuppressive, and young age. Next risk factor for tuberculosis is poverty and substance abuse. For example, is lack of medical care, which means that you may lack access to the medical care needed to diagnose and treat TB. Next is substance abuse. For example, IV drug use or alcohol abuse weakens your immune system and makes you more vulnerable to tuberculosis. Besides that, tobacco use. Using tobacco greatly increases the risk of getting TB and dying of it.
Okay, so last but not least is where you work or live. Living or working in a residential care facility such as prison and nursing home where a higher risk of tuberculosis due to overcrowding and poor ventilation. Living in a refugee camp or shelter will cause poor nutrition and ill health, and living in crowded, unsanitary conditions, refugees are at especially high risk of tuberculosis infection.
Created using Powtoon.